All right. So, first of all, thank you and welcome both of you for the webinar. We're very, very glad today to have somebody so expert in the kind of care she has been working about and the kind of things she's been working about, Dr. Eboni, to be with us. And we also have Indian care expert, I would say, Pankaj Mehrotra, with us today for this webinar. So, first of all, thank you both of you for joining us today for the webinar. So I'll give you a little space, Pankaj, to please introduce yourself a little for all our guests. And I'm here, your host, and I'll be helping around. I'm Dr. Mrigna Nagraj. I am basically founder for an organization called 50 Plus Assist, which is an at-home care service in India, which is helping senior citizens to live an active lifestyle wherever they wish to be in their life.
Okay, Dr. Mrigna, thank you very much. And Dr. Eboni, we are really glad and really pleased and honored to have you for this session of experts interviews. And the reason which we wanted people like you to come on board was to share your experience and learnings, which is kind of a rare resource as of today in the country. And we are going through our own learning curve. And we want people to help us or guide us, or at the same time inform us that this is the learnings which has already been done in that part of the world, and just share the best practices with us. The rest of it we have to take it up ourselves. And as far as I'm concerned, last time also I said it's like a 10, 12 years of corporate experience. And then from the past 20, 21 years, I've been involved with the aging sector. I worked for again 12 years with a leading NGO called Helpage India. And that is where I saw the kind of passion and commitment what people have when they come into the so-called development sector or the charity sector. Probably that is where I got that rub-on effect that somewhere down the line we all have to do our part of the, not contribution as such, but part of the larger play. And I'm happy to be sitting here today and trying to interact with knowledgeable people like you and to take this series further. Thank you.
Wonderful. It's very exciting to have an opportunity to talk about things that we are all having synergies with, which is aging and caring for individuals that are aging, whether those be our parents or, in our professional lives as well. So I'm extremely excited to have this opportunity to talk with you and to share some things that I see that are occurring and to learn from you as well.
Oh, that's excellent. I think it's a mutual
Thank you.
knowledge sharing and a learning experience. Yeah, Meghna.
So thank you so much. So I can start with like a conversational thing. So I would ask, in fact, Dr. Ebony, first question would go to you. Uh, how does the aging sector function in America in with respect to the private or the state-sponsored services or the facilities that are there in America?
I would say it's very complex. It would not be, it seems to me, and I will just add this from my professional experience, is that it seems to me that we had what would have been an initial layer of supports that we're offering our elders. And then over time, we've added as individuals have lived longer and their needs have become more complex. But rather than looking at those issues and figuring out maybe how to best make it a cohesive process for families and for the aging individual themselves, we've just kind of added different pieces. So it kind of feels like more of a, I don't know if you've ever had leftovers and you've had somebody make a soup out of those leftovers, that would be what I would equate our current system to here in the US. And that there's probably going to need to be some deconstructing and reconstructing to better meet the needs, because we have such a larger aging population now than we probably had, I would say pre 2010, when we started to see, I want to say it was like 65 million or some very large number of individuals that were reaching the age of 65 each day here in the States. If I were to break it down a little more, we do have private sector where individuals are privately paying. So they have insurance either through their job or through their retirement. Those folks are generally few and far between, or they've saved, and so they have the resources. We also have Medicare that covers a lot of preventative and medications, wellness, short-term care for elders over 65, and everyone is eligible for that at the age of 65. And then we have what we would call a safety net program. And the safety net program is more for individuals based on income, so at or below what would be considered poverty level, that are eligible for either long-term care in the home, or should they need to be relocated to a long-term care facility within their community. So you can see it's very, there are very many levels, and I could go deeper on each of the three that I just covered, because they're just that complex.
Okay.
Well,
So
that's very interesting.
yeah, so what I was just asking was as to what is the difference, how do you categorize the difference between long-term care and assisted living as such? Because these two terms are quite often used in the American dictionary of elder care.
Absolutely. So long-term care, we would consider anything that is 3 months or longer would be considered long-term care. And so this could be someone who's had a hospital stay, and now they're going to need long-term care, so longer than that 3 months, or right around that 3 months, to get their physical ability back to be able to go back home. Long-term care also includes home care. So that would be both medical home care, which would include the more complex tasks, like if you had someone who had IV medications or a wound care treatment, or really complex things where a nurse would need to be providing that, that would be considered home health care. And then you might also have non-medical home care, which would be still in the long-term care bucket, where you have someone who's not necessarily assisting with anything that would be complex or personal care, but more like assisting with cleaning, meals, light housekeeping, laundry, things like that. Assisted living is also on the long-term care continuum. And so that would be where individuals do not require 24-hour nursing, but maybe need a nurse to remind them for medications. And they would also still have access to someone to assist them with they have really nice meal prep. They have a lot of maybe shopping trips. So more things that are for an active person who's aging, but who would need just a little assistance for safety reasons, or because they would need reminders or things like that. And then traditional long-term care or nursing home care would be where a person is going to be there for longer than 3 months, and they need assistance with a few of their activities of daily living, so like the bathing, dressing, grooming, that type of thing. So see, again, very complex.
Yeah, it is like
There's a
That's
lot
true.
there.
But I think it also gives a lot of scope to understand the nitty-gritties of the system and
Mhm.
also to define it for individuals who actually are in the need of such care. So I feel
Right.
that way, well division is, I feel, a super important thing in this case. Though it may seem that we grab things, while we were doing the process, like you said, but I think the dynamic nature of it also makes it
Mhm.
something more accessible for the people in that sense.
Right.
And I feel that's the super important part of, uh, because I personally believe there cannot be box care systems. I personally believe
Mhm.
every care needs to be personalized as per the individual. So adding that, I think it adds a lot of adding details to it and adding more nomenclature to it does defines and helps in that process for me.
Yes, and I think that it is important what you're saying about ensuring that at any level of care, an individual is receiving both respectful, culturally appropriate, and culturally sensitive, um, and appropriate levels of services, and that the family and that individual would have an opportunity to personalize, and that may mean that there are certain things that you would prefer that son or daughter perform rather than someone who would maybe be hired to assist with those types of things. And so that's very important. I totally agree
True.
with you there. Hmm.
That's, that's pretty interesting. So, what are the main services or the main objectives of the organization that you work with or that you offer as in
Absolutely. So it's interesting that you ask about the nuts and soup that we would call our healthcare system here, especially for aging. But I started my career very long time ago, but as a nursing assistant, and so I worked in long-term care and provided hands-on care in the nursing home for clients that lived in that facility, and felt very fortunate to be in that role. My goal then became to be a nurse, an RN, and I did that. And then I found out about opportunities to be a long term care administrator. And so I pursued that and did that for a period of time. And what I found was much of what still rings true today globally is that until you have a parent or family member in need, you may not know all the intricacies that are associated with accessing care. And I found families would come to me with no idea. And you can see how it would be difficult to know all the different levels of care and what's paid for and what's not paid for and how to get things personalized and such. Um, so I would see a lot of families going through real emotional distress behind that. And so my husband and I, we relocated to his home state, and we started an organization that where we primarily trained people in person to provide care. And the folks that we would train would either be going to some sector of long-term care, or maybe they had a family member that was in need of care and they were going to be compensated if they were trained. They would have an opportunity to receive a stipend from the Medicare program or Medicaid program. So that's a long answer to training. We really are all about training caregivers, and I still am surprised to find that there is such a large gap in what is available for training, what is available as far as the appropriate level the interactivity of the training, the usefulness of the training for individuals who are either going to be working in the profession or who have a loved one and they are wanting to know about these things for better longevity. And here in the States, and I've been reading a ton of studies, I'm reading lots of studies right now about training, and I'm finding that it's not just a problem here in the States, it's a problem, a global problem, and that there are a lack of individuals. And so all kinds of different countries are trying different things, but we're all facing similar challenges associated with access to timely training. And so we're here to fill that gap.
Mrigna, I
That's
have
really
one question from you actually. Since
yes.
you have been giving these solutions at home care, in your perspective, how different are we when it comes to the manpower training and finding the right set of people? So, but are we on the same track or it's something totally different?
So honestly, we are on a very different track. But for example, let me begin with. So when we talk about caregivers training, it's first of all, it's not state sponsored in India. That's the biggest place where we're lagging behind in the sense. So having a state-sponsored caregivers or any kind of support in that regard would be something amazing. And and also privately also, unfortunately, right now in India, the insurances do not cover your caregivers. So if you want to hire a caregiver, it's totally up to you. Uh, because there is no incentive for people in that sense. There is no formalization in that sense. So that's why people don't even get trained. There are a lot of people who are working towards training. I wouldn't say that, the people are not trained. They are. They're wonderful. When we talk about like the healthcare part of it, they're amazing home care nursing systems and nurses who have worked for a very long time in the hospital setups and other places. They kind of assist in these things for training the other nurses. But when we're talking about the caregivers in general, that training part is missing in India at this point in time. And what really intrigued me when Eboni was talking about was that imagine the family being paid by the state to take care of your loved ones. And I know a lot of people would prefer that, to be very honest. If the
Mhm.
state would, but here, unfortunately, the care given by the family is accepted or is expected to happen
Yes.
without any remuneration, which in
Mhm.
turn adds on to a lot of stress, financial, emotional, and a lot of other kinds of burden on the individual and the family itself. And for me, it's very intriguing that if we can be on the path where caregiving can be paid for, let's say even by a private player, a private system, to begin with. Imagine
Mhm.
insurances that would cover your caregivers. So I think that would be really amazing to look at and something very new perspective for India in general.
Let's hope so. We work towards that side. That yeah.
And I'm going to say that the we have some models that we've used, or certain models with the Medicaid waiver, where you have a person who's going to stay at home, and then they would be in charge of finding their own caregiver, or they could find someone through a registry. A few insurance companies have started doing that as well, but it has been very slow. So it's taken quite a bit. And what I'm most challenged with in this space is knowing that all the training and everything that I've had access to, and you may have noticed that I haven't been online as much. Well, a couple of weeks ago, my husband's grandmother, we are her caregivers, more my husband than I, because it's his grandmother who's like his mom, and she had a medical situation, and so we have been dealing with that. And I had a discussion with someone, and they said, well, because of your training and expertise, is it less stressful for you when something like this happens with grandma? Does is that I can be so cool, calm when everybody else is, very nervous and upset. That my nursing training gave me that. But then, like a week or two later, I'm just crying and I don't know what. And so I still do process the fact that we're going through challenging situations. It's just my nursing training has taught me to put that on the back burner until grandma or whomever is safe and secure, and we've got her together. And now I can put the mask back on for myself. And I find it very distressing to know that so many caregivers worldwide don't at least get to have the comfort in the moment that they're doing the right thing because they've got their training hat on. And then we're always going to deal with the emotional part of a parent or a grandparent. And, how we deal with that is going to be up to having appropriate tools for that too. But yes,
I
it's
completely
something.
understand and agree with your situation. Honestly, I have been caregiver for my grandmother for some time, and she was somebody with dementia. And what my training taught me helped me to navigate through situation. But yes, it did not make us. I mean, like you said, you just put on a face and you go ahead with the responsibilities day to day, but doesn't makes it easier at all.
No,
The caregiver
no.
burden is there. Yes, the training helps to at least have a sense of satisfaction that yes, you are trying your best and you're trying to do the best, that is possible in the situation. But you're absolutely correct about it, and it can be a lot of, I would say, guilt associated to it, the emotional burden associated to it. And let's talk about since what are your thoughts on that one, Ebony? How does US deals with this?
With respite?
Yes.
With respite care. Yes. So with respite care, we have again those same systems that are available like Medicaid. Medicare does not pay for respite care. Perhaps a person's insurance might cover respite care. Oftentimes, the challenge for caregivers is number one, finding someone that you trust to come in and give you the break. Number two, because when you change, your governor or whomever, that can shift policies. And so some people will not seek out, respite care that's paid for in your state because they feel like once I become accustomed to having it, this could change. And then I'm going to then feel worse because now I'm not even getting the break. Or they feel guilty about taking the break with respite.
Yes.
And then the final thing would be I can't remember the name of the source, but one suggestion with respite is to take a full 8 hours away. So, say you have 12 hours of respite or 16 hours of respite, rather than doing that in like 2 hour increments and you could have it more frequently, the suggestion is to take a full 8 hour time frame so that you can actually unplug from the caregiving situation. And so we do find that caregivers may not use it adequately for those reasons, although it may be available. It may be available.
That's
Yeah,
interesting.
that's interesting.
Mm-hmm. Yeah.
Oh, that's nice. That's nice to know. And I think you are very right. There is a lot of guilt associated with unplugging yourself from the situation.
And you
Though it's
must.
very true.
Yeah.
So honestly, I tell all my people who are into caregiving sector and while I'm training that imagine it's like a plane, and in the plane, what instructions do you get? In case of emergency, pull your mask first and then help
Mhm.
the person who is next to you. So this is my suggestion to anybody or everybody who's listening, who is in a caregiving situation or who is even trained to be a caregiver. Pull your mask
Yes.
first and then help the person next to you.
And I
It's
feel
super
like if we
important.
don't do, I'm sorry, I feel like sometimes we don't do a good enough job of saying that up front because oftentimes the caregiving situation comes from an emergency.
True.
So then when do you back up and have a chance to becoming overwhelmed if you haven't had an opportunity to kind of get a normal path under your feet for after the emergency. So, even something as wonderful as having this discussion with two other like minded people who is very encouraging and I find it supportive. So, sometimes for caregivers, the challenge is they don't have access to wonderful people like you where we could sit down and have a conversation that knowing that somebody else is going through something similar, that's often enough too for folks to feel like okay, other people, it's not just me, other people feel this way, this is stressful, I have to take care of myself, and yeah, so I think that's very insightful what you mentioned.
I
Yeah,
100%
that's
agree.
wonderful.
Yeah, I 100% agree because it can be a very daunting and a very, very demanding activity, I would say, which we think, yes, it is our responsibility. But I think all of us need to have that responsibility with ourselves first, that we need to wear the hat properly ourselves. Then only, as Mrigna said, a plain example. Because
Right.
personally, I have seen that probably every 2 months or 3 months, I start slipping on the stress level, and then as a reaction, obviously different modes of the personality keep coming out. That, as they say,
Mhm.
the 50 shades of gray come in because you yourself are so
Mhm.
stressed from inside, and
Yeah.
obviously you can't discuss it, or you can't even tell the person requires care, because that is where the empathy and the guilt also comes in, that okay, poor person or someone who's requiring care himself or herself are in such a situation, and how do I tell my problem, so whom do I tell? So I think this is a very
And
good
our culture, I think that we're very there are some very unique similarities in how we revere our parents and grandparents. And so to give any hint that you're distressed when you are caring for someone who likely cared for you, ooh, that's really can make you feel guilty. But we're people, so we have feelings and we're entitled to them.
that's true.
Yeah, that's very beautifully said, Dr. Ebony. That's very beautifully said indeed. And now I'll take the conversation towards the book that you're an author to, and something that is, I think, should be a manual for everybody who's caregiving, I would say. So please, I would love that you would talk about it, please.
Sure. So I have a couple of books. I have one that's actually coming out on Thursday, and it is Beyond the Yellow Brick Road, Finding Your Emotional Home as a Caregiver. It's one of the longer, what I will say, and the reason why I say that is because you have an opportunity with that book to actually chart your own path. It's not about anything that you're doing necessarily for the person you're caring for, but how do you have good, strong emotional health for yourself? And I do know that for me and other caregivers that I've worked with, that changes over time. So it's really designed for you to take some questions at the beginning and then find out where you are maybe most needing to feel at home emotionally, and then start there. The other book that I would really highly recommend, just as a foundation, is the caregiving book, Caregiving Things You Need to Know. And I say that because that covers all of the main things that we all universally experience. And that can include things like, meal preparation, what are certain disease processes, how to talk to siblings or other family members to get them involved in the care so you're not doing everything. Planning for talks with doctors, because even when you're uh, in a position where you help other people, oh, I'm terrible at a doctor's appointment for myself. I can't remember what question I want to ask. I don't know what they said. So I have to often bring my husband with me so that he can take in the things that the doctor is saying when it comes to me. And then I'm definitely there for everybody in the family if they have a doctor's appointment or have something major going on. And I ask all the appropriate questions and know what we need to do from there. So the things you need to know is just that. It's a friend to be there for things you need to know throughout your caregiving journey and to document things. And that's really for the care of your loved one.
That's beautiful indeed. And we are very excited about your new book and getting our hands on it as soon as possible. So
Wonderful.
congratulations on that one, please.
Thank you. I'm really excited about it because it's not traditional in the sense of what you would think about with caregiving, even the artwork and things that are in there. It's more about us, and let's find some common ground for those of us who are out here doing magical things in a good way in the caregiving space.
Okay, excellent.
That's
Ebony, I have one kind of a query as such, which I've been trying to
Yes.
figure out. What I understand is America, again, you have state respective standards rather than central authority, which lays down the standards and guidelines. Like in Australia, you have a national guideline, or in the UK, you have probably NHS trying to run it out. But like Canada, you have these provinces have their own standards. In Australia, America, I believe you have state-wise. Similarly, in India also, we are technically supposed to have our own standards. So is that true, or it's a national standard?
We have two. So when you're a long-term care administrator, you get to have all this fun of reading all of those exciting, dry regulations. So for Medicare,
Oh,
Medicare, which funds the nursing homes, you have Medicare laws. So if you want to participate in the short-term rehabilitation and short-term stays in nursing homes, you must meet the federal requirements. And then every state also has additional laws in place for each of the 50 states for being included in like Medicare, Medicaid, or any other programs. You would have to be compliant with the regulations. And that's what makes it confusing, because you have these specific federal regulations and you're meeting all of those. Now, the state also, on top of that, has additional regulations. Sometimes they are complementary, so it's not confusing, but also there are times where it's not complementary and you just have to know every state. And as an administrator, you would have to take a federal test to become a nursing home administrator. For example, here in Nebraska, I would take the federal test that's all over all of the federal requirements for the whole country, and then a second state test with so many questions on it to be licensed in the state as an administrator. So it's very complex. It's very complex.
Yes, I think sounds like a lot of red tapes, but I feel it's very needed in the situation at
Yes.
times, and it really protects the rights of the individual. So
Hmm.
I think, well, some things which are necessary evils like this,
That is very true. You've got to have good standards, or people, you don't know what will happen with your vulnerable adults who are more dependent, and not necessarily folks who are aging healthy. And grandma's 88 and she is up walking and doing all of the taking care of herself, and has been doing that all the way up until the last few weeks. And she's having a slow recovery, but she's 88 years old. So you want people to be taking, if they're going to take care of your 88-year-old grandmother, you want them to be following those state and federal regulations.
Very true. Very true.
that's
So, but I just one last question from my side as such for this particular session. What is the actual difference between a Medicaid and a Medicare? Because that keeps getting confused
That
sometimes.
is excellent. Yeah. So Medicare is what funding comes from the federal government. So it's in the whole all 50 states, or and then Medicaid. There are certain requirements that states would have for participating in those, for receiving funds. So Medicare is short term. So, meaning like if I go to the hospital, usually you're not in the hospital longer than 7 days, hopefully. So, that's considered short term care. Whereas Medicaid covers more long term care, which would be that 3 months or longer. That would cover. And the reimbursement rates are different, because if you have somebody who's very ill and at a hospital level of care, they intuitively are going to require more resources, but it's for a shorter period of time to get them back to their what we call highest level of functioning. So basically, maybe back to where they were before the incident or illness. And then Medicaid is like that maintenance. So you could receive that in an assisted living, you could receive that in nursing home, depending on how high your needs are, or with waiver services, Medicaid waiver services, you might receive it at home by a family member. So I just think short term, long term. Medicare is short term, Medicaid is longer than that, 3 months.
And these are also provided by the private agencies, if I'm not mistaken, or are these two totally by government as such?
They are, they overlap. So for example, you also could interject into that private insurance. So some people will be at the hospital and they'll receive Medicare, and their private insurance will pay whatever the co-pays or the Medicare coverage doesn't pay. If you have somebody who's maybe their income is at a level at or near the poverty level, they will receive Medicare, and then their co-insurance or whatever Medicare doesn't pay for, their Medicaid would pay for. But they have to apply for that and be deemed eligible for it. And sometimes there are, waiting lists depending on, how many people are using it within your state. But it's something that we have become very reliant on for paying for care for our elders.
right. All right. It's very interesting. Thanks for the question, Pankaj. Actually, it's very interesting to know the difference between the two and
Mhm.
how it overlaps, in various areas. It's very interesting to know. So,
Mhm.
my question to you, Dr. Ebony, would be any particular case study or large impact initiative that you've conducted yourself or you're aware of that really affected the way that you think, your thinking process has changed by that? Could you please share that with us?
Sure. So, one of the organizations that I have the pleasure of being on their steering committee, you might see them from time to time, especially on LinkedIn, is the National Alliance. They have a steering committee that is helping them really shape what caregiving supports via the research angle are needed across the United States. So I enjoy that and have benefited and have hopefully provided some level of expertise and insight into how we can share best practices, as we were talking about earlier, with this very unique opportunity for us to share and bring in other folks. And that's an additional, I won't say an additional, that is the benefit of being a part of the National Alliance for Caregiving Steering Committee. There were certain there was funding put into our Build Back Better bill a couple of years ago. That was a national bill, and the National Alliance has 3 or 4 years of a steering committee working together to look at research issues that relate to caregiving. I also really enjoy my ability, my proximity to students who are getting their professional doctorate or their PhD. And a lot of times I have an opportunity to, as their chair, or as I teach a lot of the research courses and such, to kind of help us, let's figure out how we can solve some real world problems and apply our research so that we can, again, get best practices involved and then share them across the board so we can all improve elder care.
I know. That's indeed wonderful. Pankaj, you had something to say. I'm sorry.
No, I think it's been a great interactive session where we got some insights about the global practices and specifically in the American aspect, because I'm sure this kind of a subject, and with Dr. Eboni on our show, we can't do justice just in one episode. Probably we'll have to have 2 or 3 of them. But yes,
Yes.
just to get the feelers and to test the waters, I think this is excellent beginning where we have Dr. Mrigna, who brings in the experience of the Indian markets, as well as now she's based in Brazil. So we are getting to understand the Brazilian market also. Eventually,
Yes.
eventually intergenerational, inter-country, inter relationships and inter-professionalism will actually bring in the best soup out of the entire activity. And when we start doing these things or filtering them down into real uh, uh, real points from each
Mm-hmm.
session as such, then I'm sure there would be a certain amount of value which would be seen by the industry as such, and as in
Mm-hmm.
general stakeholders or even the users themselves. So they know where to go in for or what particular aspect to look at, because I think the biggest problem is that most of the people are not aware of that particular term or a particular service. So once we do these kind of awareness generation things, they will understand, okay, there's something called respite care also, which we can do, and which is actually not a rocket science. It's actually someone getting a break, which is a very
Right.
important part of the caregiving, whether it's an institutional part or the residential part. So I think it's, I
Mm-hmm.
really appreciate and really thank you for coming on board. And we look
My
forward
pleasure.
to sessions. Off,
Yeah.
over to you, Mrigna.
Thanks a
Yes.
lot. In fact, it has been a lot of learning and has been wonderful for me also. And I think, like, I agree with you, Pankaj. We need to go back again and again. I feel Ebony is somebody who can really guide us about, especially the caregiving part of it, the emotional, the mental. That would be my next, idea with her would be to speak about all these matters. So thank you so much, Ebony, for your time and for your knowledge. Thank you so much. Indeed, a pleasure for
Well, thank
us.
you. Yes, and thank you guys for I hope you can cut this part out, but for being up so late to talk to me. And you look beautiful.
I'm almost at the same time zone. It's just Pankaj who is up and about. Now it's going to be, I think, almost, yeah, it's going to be 4 o'clock in India.
Oh,
So,
oh,
Hmm. So
oh,
that's the
boy.
interesting part, and by mistake, when someone called up, sir, can we meet up at 11:30? I said, yeah, not a problem. Then at 1:30 in the morning, I'm realizing, oh, I have a meeting also. No, but it's
Well, your
always a
review,
great charger to
yes.
come and learn from people like you, as well as from the other guests we are getting and we have got. It's really admirable that with so much of compassion and so much of professionalism, what people are bringing on the table from across the
Mhm.
globe. So once again, really appreciate Ebony, and hope to see you again on this session again.
Absolutely. Absolutely. Thank you so much.
Thank you for coming on board.
thank
Okay,
you.
Rita.
All right.
Right.
Bye.